Come in.
Hello, how are you today?
Hi, I'm good.
My name's Sean, I'm your nursing assistant. I hear you need to use the bedpan.
Yes.
Alright, may I check your ID bracelet?
Mm-hmm.
Alright, Miss Teresa, you have your call bell here. I'm going to go wash my hands. I'll be right back.
All right.
At this time, I'd go wash my hands using proper technique. And when I return, I will place my gloves. And anytime I put gloves on, I'm thinking resident privacy. So, Miss Teresa, may I shut your door and your curtain?
Yes.
Alright, I'm actually going to shut her curtain as an added measure to protect her privacy and modesty. Since we're going to have her on a bedpan, nobody wants to have somebody walk in on them. Alright, I am working a little expeditiously because I know she has to use the restroom. Place one towel here on the overbed table. I'm going to get one washcloth that will wet to wash her hands when she's done. And I'm going to go ahead and get an incontinence pad. Now let me show you about this incontinence pad. These are not perfectly square, they're actually rectangular, and the longer portion goes across from side to side, okay? The shorter portion of this goes from head to toe. So while I have this out, I'm going to go ahead and roll it nice and tight if I can. I'm going to roll about 2/3 of the way, maybe halfway is fine. And then I'm going to fold it and set it on my table here. Alright guys, so I'm going to move around this other side so you can see exactly the technique I use to place this. I'm going to borrow that from you, Miss Teresa. And prior to rolling a resident, we always want to lay the head of her bed flat. Miss Teresa, do you mind if I lay your bed flat?
No.
Okay. And then I'll show you the technique on how we place this incontinence pad properly. This is just in case we have any spillage, so it'll keep her linens clean. Alright, Miss Teresa, I'm going to expose you just a little bit, okay?
Okay.
You want to keep exposure to a minimum. Alright, Miss Teresa, what I'm going to do is assist you to turn onto your left side. I'm going to place this incontinence pad, okay?
Okay.
So, you can place your hand on the hip and on the shoulder. And at the count of 3, I'm going to assist you to turn. 1, 2, and 3. Okay. I'm going to adjust your pillow. How's that, Miss Teresa?
Fine.
She's a safe distance from the edge of the bed where she will not fall. And this is how we place the incontinence pad, guys. So I've got it rolled up nice and tight. I want it about halfway up her mid-back here. If you go any higher, when you take it out, it's going to get caught up under her shoulders and it's very difficult to remove. So, alright, Miss Teresa, on the count of 3, we're going to roll over a little bump, okay? 1, 2, and 3. Alright, good job. Alright, I'm going to go to this other side and roll this out. Let me adjust your head, Miss Teresa, can you? Alright. Now if you would, just lean up a little bit and I'll assist you and we'll roll this out the rest of the way. You don't usually have to do a full turn there. Alright, are you pretty comfortable, Miss Teresa?
I am.
Alright, do you mind if I go into your bedside table? I'm going to grab your bedpan and go ahead and position it, okay?
All right.
Alright, there's 2 kinds of bedpan. One is a fracture pan that's as thin, and this is a regular bedpan. Fracture pans used when people have had a broken hip or can't really tolerate this big bump under them. And this little pocket here always goes towards the head. It's used to catch any overflow. Alright, Miss Teresa. What we're going to do is I'm going to assist you to turn again, okay? Let's turn on your left side. 1, 2, and 3. Okay. And we'll keep exposure to a minimum. I can place this bedpan here. And I'm going to kind of hold it. And we're going to roll back on it. Okay, Miss Teresa? 1, 2, and 3. Alright, it's not real comfortable, especially laying flat, guys. So what I'm going to do is raise the head of her bed back up so she can actually use the potty. Miss Teresa, you tell me when you're comfortable, okay?
Okay. Okay.
Okay, alright. Alright, Miss Teresa. Let me give you this call bell. And I'm going to go ahead and get you some toilet tissue.
Okay. Thank you.
While you use the restroom, I'm going to step over to the sink and step out and give you some privacy. I'm going to wet this so you can wash your hands when you're done, okay?
All right.
Just call me when you're done.
Okay.
Hi, Miss Teresa, did you call me?
I did.
All done?
I am.
Okay, we'll get you off this. Now this wash rag, half of it's wet and half is dry. You can just wash your hands and dry them there. I'm gonna go ahead and lay the head of your bed flat so we can get rid of this bedpan, okay?
All right, thank you.
You're
Okay.
welcome. There's nothing you can do to make that bedpan comfortable, but you can do little things like sit them up in a position that's more normal to be in when people relieve themselves. Alright, so I'm going to come back on this side so you can see how I remove this bedpan and this incontinence pad. It's one of the two techniques. You can roll someone if you'd wish, like with the same way we placed it. I like to ask the resident to bend their leg and put it like this so they can lift their hips up and go ahead and bend your other leg up. Of course, if they're not able to do that, then we'll roll them. Alright, Miss Teresa, at the count of 3, I want you to lift up your backside, okay? 1, 2, and 3. You can pull both out at the same time, just like that. Alright, Miss Teresa, I'll get you more comfortable in just a second, okay? I can set my incontinence pad here on the overbed table, and I can go wash or rinse and dry this. Now, when I go into the bathroom, all the contents here, I'm going to pour into a bedside commode or the toilet. Then I'm going to rinse from the outside in, or the cleanest point to the dirtiest point, dumping all the contents in a bedside commode or toilet. I'm going to dry from outside in, or cleanest to dirtiest. Let me go do that now. Okay, now I'm going to demonstrate how to clean a bedpan. Again, the contents of a bedpan or any basin does not go into the sink. It'll all go into the bedside commode. So let's go ahead and turn this water on. I'm going to raise this because I know I'm going to need it. I'm going to add a little water here, and I'm just going to kind of switch this around, make sure I get all the contents. And I'm going to go ahead and dump this in the bedside commode. Now again, we're going to rinse this from cleanest to the dirtiest point. Now this is a very large basin, so it's hard to get under the sink without touching anything. Do your best. I'm going to use a napkin to really assist me do a better job at that. And I'm going to clean the rims before I go into the basin itself. And again, the contents will all go right here in the bedside commode. Now that I'm done, I'm going to go ahead and clean this or dry this bedpan. I'm going to do it using the same technique that I used to rinse it, from the outside in, or cleanest to dirtiest, okay? So let's go ahead and do that now. Get this nice and dry so we can put it back in the bedside table, and when we need it again, it'll be there for us, nice and clean, ready to go. Okay? And we'll dry the inside first. Okay? Now that I'm done, I want to make sure that I shut my bedside commode, and I'm going to use a barrier to take this back to the room and put this back in the bedside table. So I'm going to use this to open the door, place this back, and then, since it's a bedpan, I'm going to change my gloves prior to continuing with the procedure and cleaning up the resident's room. Let's do that now. Alright, when I return, Miss Teresa, may I go back in your bedside table?
Sure.
Alright, I have a barrier, so I'm going to go ahead and put this back where I found it now that it's clean. And I'm going to go ahead and change my gloves. Alright, just to be safe, I don't want to take any chances. My hands are a little sweaty, so you definitely, it'd be a little bit more difficult to get the gloves on, but it's okay, it's just what we do. You just work them on, and if you get a tear, you'll go ahead and take it off and put another one on. And these are large gloves, so they just get sticky whenever you sweat. And this is hard work, so. Alright, Miss Teresa, I'm going to set the head of your bed back up, okay?
Okay.
Tell me when you're comfortable.
Okay.
Pretty good. Alright, I'm going to place the bed in its lowest position. All right. And now I'm going to go ahead and get the resident taken care of first. She has her call bell in her hands. All right. I'm going to make this bed nice and neat because neatness does count. Okay. I'm not going to make a career out of it, but all right, Miss Teresa, do you need anything else?
No?
Okay, I'm going to get your room tidied up. May I open up your door and curtain?
Yes, please.
Okay, terrific. All right. All right, I'm going to come over here and do a post-procedure check. So her bed is in its lowest position. She has her call bell. The head of her bed has been adjusted for her comfort. All the supplies are put away, her door's open, so I'm going to deglove. Go wash my hands using proper technique. Come back and announce to the evaluator, end of skill.